Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I am the prenatal and pediatric chiropractor here at the Cap Wellness Center. And today's guest is Dr. Adrienne Carmack. She's a urologist, and she's also an expert on circumcision. She's written a book about the subject, and we're going to be talking about the research that she did really as a doctor wanting to give her patients a fully informed choice when they were considering circumcision. And really what our conversation is going to be around is what that research showed as far as dispelling a lot of the myths that surround circumcision. We're going to be talking about the risks, the benefits. We're going to be talking about what she recommends to her patients when they ask questions around kind of the look like daddy issue and the locker room issue. So let's switch over to that conversation in a moment. But before I do so, let me take a moment to get a word from our sponsor, the Cap Wellness Center.
Hi, I'm Maureen Higa, and I'm the acupuncturist at Cap Wellness Center. One of the things I love about working at Cap Wellness Center is getting to be around all the brave, strong, and inspiring women. I'm always inspired by my patients' ability to rise to their challenges, overcome obstacles, and also get creative in their pursuit towards their health goals. I feel honored to be a part of their journey, whether it's helping them to start a family, have a healthy pregnancy, or helping them through their postpartum recovery.
All right, and as always, I want to thank all of you who are sending in such great feedback to us. Your ratings and reviews in iTunes have been fantastic. Thank you for that. And also all of your feedback that you're sending in to us, either through the Facebook page at the Cap Wellness Center or through the emails for questions about the past episodes or, great suggestions for topics that you'd like to see covered on a future episode. And I also wanted to make mention, this was really sweet. I got the first time an email this morning from a mom that's been listening to our podcast with a birth announcement and a picture of their little one. They're not here in San Diego. They're not part of the Cap Wellness Center, but they are part of the Healthy Births, Happy Babies podcast, and they've been listening along all the way throughout, getting ready for the birth. And she had her baby just last week, and so I want to welcome to the world little baby Iva. She just is so sweet that this listener reached out and shared that with us. So congratulations and welcome to the world. So now let me introduce our guest, Dr. Adrienne Carmack. She's a board-certified urologist and a mother of 3 children, all of whom were born outside of the hospital and none of them were circumcised. She's the author of Reclaiming My Birthrights, A Mother's Wisdom's Triumph Over the Harmful Practices of Her Medical Profession, and also The Good Mommy's Guide to Her Little Boy's Penis. That's what we're going to be talking about today, that book around circumcision. So with that, let me switch over to my conversation with Dr. Carmack. All right, Dr. Carmack, welcome to the podcast.
Thank you for having me.
Yeah, well, it's today's topic as far as circumcision and really getting down to like with the facts and the myths and really around the issues is something I've been asked a lot about in my practice, and I'm really happy to have you as an expert on to share your wisdom around it and really the facts around it so a parent can make an informed choice rather than just kind of going along with what's always ever been done. But before we get into that, and I want to talk about your book, you're a practicing urologist. How long have you been practicing?
I started training in urology in 2003.
2003.
And I've been out of my training since 2007.
Okay, great. And how did you become so interested in circumcision enough so that you've written a book about it?
Well, it came from exactly what you said, a desire for informed choice. And when I was a resident in urology, I felt like in all situations it was my duty to tell the patients the risks and benefits and let them make their own decisions, but to give them accurate information. And that was for everything, but for circumcision in particular, at the time, the American Academy of Pediatrics statement was that it was a parent's choice, that there were risks and benefits, and these, were an individual decision. And I believed that. And I had no doubts about circumcision at the time. To me, it was the normal thing to do. And So when I went to the literature to read about those actual risks and benefits, to be able to tell my patients, this is the UTI reduction risk, or this is the risk of harm, et cetera, I found that it actually wasn't really valid, that the benefits were very weak and that the risks were real. And further in my career, I just saw a lot of complications from circumcision, and knowing that the benefits weren't there and that this didn't need to be done, it really struck me as a violation of the ethical tenet of first do no harm. And it was hard for me to understand why it was done. And I believe it's just from misinformation and, cultural practices that have been perpetuated for many years.
Right. Well, and the common reasons that parents are told that circumcision is the right thing to do is, one, hygiene, and then also disease prevention. Is disease prevention what's always commonly said in the American Academy of Pediatrics statement is urinary tract infections, penile cancer, and possibly transmission of some sexually transmitted diseases. What you found that is not supported?
So I think there's a big problem with the wording that's used here, which is prevention. To me, prevention means you keep something from happening, and circumcision absolutely does not keep any of those things from happening. Now, it probably reduces the risk somewhat of all of those based on the data, although the data's got some problems and there's some data that contradicts it. Like, for example, for UTIs, there's some data showing that boys who are circumcised have a lower rate of UTI, but there's also some data showing that in a prospective study, if they circumcised boys with an underlying congenital problem, it did not affect their UTI rate. So there's some question about that. But the thing is, a UTI is not a reason to amputate a functioning body part. And, in little girls, honestly, like theoretically, it might really work well to amputate their labia minora to lower the rate of UTIs, but no one's going to do that. No one's going to try that and study that and see, because there's no need to remove that tissue. UTIs can be treated in other ways.
Well, and again, like with prevention, it's something that, like, how in the research are they able to, without prospectively looking at it, determine that? I mean, specifically, I saw a study or a report, I should say, from the World Health Organization talking about circumcision decreasing the rate of infection of HIV, but it never really said why a circumcision would prevent that, whether it's behavioral or physiologic. Do you know anything about that?
Yeah, and the HIV studies are a good example of this prevention, quote unquote, prevention misuse as well, because the word prevention is still used all the time in professional scientific writing, and circumcision absolutely does not prevent HIV. People who are circumcised get HIV all the time. The U.S. has a very high HIV rate and a very high circumcision rate. And the studies, one of them, it was a prospective randomized study, and they looked at what percentage of men in a high risk, very high rate of HIV population in Africa acquired HIV during the study. But the problem is they only studied them for 6 months, and then they stopped the study early because it showed significance. But I would suggest that for 6 months after surgery on your penis, your sexual practices will be different. So I'm not sure that 6 months is long enough that change is going to hold out. And the other problem is that change was something on the order of, I'm sort of estimating here, but going from 3 in 100 men who would acquire HIV who did not have surgery down to 1 in 100 within 6 months who did have surgery. And, I'm not sure there's much real value in that. It doesn't mean that you wouldn't use a condom or that you wouldn't use some other safe sex practices. Like, is your chance of HIV being 1 in 100 really that, going to change the other things you need to do? So I suppose if you're in a world where you think that people can't make decisions for themselves and they can't choose other means of lowering their HIV transmission rate, that might make sense in a paternalistic way, but I don't think that's, really, I think informed choice is a better approach. And I doubt that these men were truly informed that they could still get HIV after circumcision.
And what about the penile cancer rates? I know that's something that's always, touted as a reason to have your boy circumcised.
Right. So most penile cancer does occur in the foreskin. And so by amputating it, you are going to have less cancer in that area. You can still get penile cancer in other areas. But that's the same for any body part. I mean, an ear problem comes from your ear, and we could cut your ear off to avoid problems with the external ear, but we don't do that. The things with penile cancer that actually cause it. Having a foreskin does not cause it. It happens there, and so it's more likely. What causes it are believed to be HPV infection, which comes from sexual transmission, and there are plenty of ways to reduce that risk: smoking and poor penile hygiene. And then phimosis, which is a disease of the foreskin where the foreskin is closed too tight, which is most commonly caused by diabetes, which is a lifestyle problem. So with that information and education, it's not that hard for a man with a foreskin to stay healthy. And the American Cancer Society even says that they do not recommend circumcision for that reason. Instead, they recommend not smoking, good penile hygiene, avoiding HPV.
Okay. Well, let's talk about penile hygiene because, and I guess before we even talk about hygiene, we should talk about the normal physiological function of the foreskin. Can you share with our listeners about just, it's there for a reason, right?
Right. Absolutely. Just like all of our body parts are. Right. I mean, the appendix is a good example because for a long time, if a surgeon was operating for any reason and they saw the appendix, they would just remove it to prevent appendicitis. And they stopped doing that because when you do surgery, it causes risks. And if they removed an appendix unnecessarily and then the patient had a bowel leak from where the appendix was removed, that was a life-threatening problem for something that didn't need to be done. So they stopped doing that. And they stopped doing it before they knew that the appendix had any function. They stopped because there was a risk to it and it wasn't necessary. But since then, we've discovered that the appendix does have functions like holding probiotic bacteria and things like that. And so it's, very similar with the foreskin. And it's hard in this country where a lot of physicians are circumcised, a lot of fathers are circumcised, and they don't know what a foreskin is like. They have no idea because they've probably never seen one. So the foreskin has a couple of main groups of functions. One is physiologic, and that's related to the actual tissues that are present. There are a lot of nerve endings in the foreskin. It has a very significant sensation. So much so that some men can orgasm just by stimulating their foreskin. You can Google this and see videos of this. It's real. It contains immune cells. It contains a whole host of cells. It's lined on the inside with mucosa, similar to the lining of the vagina, which is important for lubricatory functions. So in a circumcised man, you're not getting any lubrication from him during intercourse. But with an intact penis, you do get lubrication. So both partners are having lubrication, which is kind of important for the biomechanics of friction. And then that's partially physiologic and partially biomechanical. And then another biomechanical function just comes from the simple volume or presence of the tissue of the foreskin. So it allows the penis to accommodate an erection because the foreskin, when the penis is flaccid, the foreskin folds over the head of the penis and protects it. But when there's an erection, it stretches out and allows the penis to enlarge without tension or pain. A lot of men with circumcisions that have been done, quote unquote, tightly will have pain with erections because it pulls. A lot of them, by the time if it was done as an infant, by the time they're adults, they don't really notice it anymore because it's become their norm, but it's a very real problem. And the gliding motion of the foreskin is also really important for reducing friction during intercourse.
So then when it comes to hygiene, as you said, there's immune cells in there. It seems like it's a protective. Why is it said that possibly like a uncircumcised penis or an intact penis is less clean?
Well, that comes a lot from the notions of cleanliness that we have in our society and our culture, which the foreskin produces far less secretions than the vagina, but those secretions for some reason are considered dirty in men and not in women.
Okay, so it's not that, it's a harborer of extra bacteria or that it's more likely to become infected. It's just that's kind of cultural norm of those secretions being thought of as unclean.
The foreskin should harbor bacteria, as do all other healthy body parts. Our vagina should have bacteria in it. Our mouth should. Ideally, those should be, it should be a healthy biome. And to my knowledge, the normal flora of the foreskin has not been studied very well yet. But it is, it's part of our ecosystem that's meant to be there. And we're meant to be living in balance with our microbes in those regions. Okay. It can certainly get out of balance and you can certainly have problems from it.
Right.
But again, that comes down to lifestyle.
Okay. Now, if a parent decides to do a circumcision, when is it typically done? How soon after birth?
Usually in the hospital within the first day or two.
Okay.
Yeah.
And can you describe what you know about that experience for the infant, what we know now? I mean, years and years ago, they didn't even use any kind of numbing agents or the like because they felt babies didn't feel pain. We know that that's not true. What do you know about the experience that the infant goes through with that surgery being done?
Yeah, it used to be said that not only did they not feel pain, but they also wouldn't remember it. And that's still said today, that babies don't remember. And I think, even from a psychological standpoint, most of us now understand that our childhood experiences, whether we remember them or not, if they were traumatic, they affect us, even if we can't directly recall the memories. In terms of the pain, there was a study comparing using anesthetics to no anesthetics in babies, and they aborted the study because they found that not using anesthetics at all was just torture. There have been studies looking at cortisol levels, stress hormone levels in babies when they undergo circumcisions, and they really skyrocket. And, those of us who are interested in attachment parenting know that one of the main goals of attachment parenting is not to raise your baby's cortisol, not to raise their stress hormones. And that's something that circumcision clearly does in a pretty dramatic and drastic way.
Right. And so, I guess the next question I want to talk about is really kind of based on your book, The Good Mommy's Guide to Her Little Boy's Penis. And what is, if a parents decide not to circumcise, how do you care for the penis in any way that might be different than a circumcised penis?
Yeah, that's a really important question. And that's why I wrote the book, because I see a ton of complications in intact boys that come from being given bad advice about how to care for their foreskin. A lot of physicians and nurses believe that for some reason that the foreskin needs to be forcibly retracted. And that's really harmful. The foreskin is designed biologically to separate on its own over time. And this happens at varying times, sometimes not up until puberty, sometimes earlier, usually during childhood. It separates from a combination of the child manipulating the penis and foreskin himself, and also the production of smegma, which is a substance that helps separate the attachments of the foreskin to the glands of the penis. So forcibly retracting it is like pulling your nail off. I mean, it's traumatic.
And your fingernail off.
Right, right. The attachments are similar to that of a fingernail to the nail bed. And that's something that has to be done during a newborn circumcision, is they forcibly separate those with a probe before they stick a probe into the opening of the foreskin and separate the foreskin from the glands, like tear it off with the probe and then cut the foreskin off. So forcibly retracting is not recommended at all. Soap is a problem, and soap is something that's, again, in our, ultra hygiene conscious society, we tend to go too far with things. I mean, you wouldn't put soap inside your vagina. You wouldn't put it inside your eyelid because they're mucosal surfaces, and soap dries it out. It disrupts the microbiome. It can cause irritation. It's not needed in most cases. So in general, when they're babies and they're still intact, you just wipe the penis, and it's recommended you wipe it from the base towards the tip so that you're not pulling the foreskin back too hard. It's recommended you not pull the foreskin back and you not use soap on the inside of the foreskin. As they get older, then, as a parent, I've told my own son to pull his foreskin back and rinse it with water whenever he takes a bath, and then to always make sure he returns the foreskin back to cover the head of his penis after he's done.
Okay. And I think that, your book that you had sent me that I read through, it does a really good job at explaining those things in a very simple way for that. In a way, to me, my son is not circumcised. And so, we learned all of those things just to be conscious parents, to know how to take care of him. But at the same time, it's very natural, and it's not anything extra that you have to do anymore. No. So that a lot of parents will think of if I don't circumcise, leave tissue that was physiologically present and purposeful on my boy's body, then I'm gonna have to do extra work. Right.
And that's, a lot of nurses say that because when they have elderly patients who they're having to care for completely and catheterize, it requires a little bit more cleaning, but it still doesn't even approach the level of cleaning that's needed for a woman. So it's it's not that much more work at all. And that's a funny thing, because I wrote this book about caring for an intact penis, which is actually quite simple, but most of the book is dispelling myths about it and educating people on things to help prevent harm coming from misinformation.
Right. And with this type of information that you're helping spread and parents learning more about it, what have you seen or know about rates of circumcision in the U.S., worldwide? How is it changing?
Rates of circumcision are definitely going down in the U.S., but there are still plenty of hospitals where parents aren't really being informed, where they're being asked completely unnecessarily during pregnancy or right after childbirth, do you want your son circumcised, and not being given a full discussion of the risks and benefits. There have been studies done on this where they've looked at whether parents are truly being given the information. And in a lot of places, it's still not happening.
And what about, I guess one of my last questions I want to talk about is, the look like daddy argument of that if a circumcised dad wants their child or thinks their child should look like dad, meaning circumcised if there is. What advice do you give parents around that subject?
So, it kind of sounds silly when you say it, but it's actually a really big, deep issue. And I've also studied female genital mutilation quite a bit. It's something that intrigues me. And when you watch videos of the women in the cultures who do that, they say the same thing as men do in our culture. They believe that their daughter needs to look like them, to be a woman, that she needs to, that it provides benefits by reducing, this and that problem, and that without it, their daughter's future's, questionable and scary. And it's so analogous, and people don't see it that way, because to us, the idea of cutting a little girl is just, what? Why would you do that? But for some reason, cutting a little boy seems just fine. But I think it goes deeper than that. I think for a lot of circumcised men, it's hard information for them to hear, because one, a lot of them do enjoy their penis quite a bit, and they have what they feel like are great sex lives. And I don't doubt that. I think that they truly don't feel like there's a problem. Now, plenty of circumcised men do think there's a problem. And actually, I'm going to mention a friend of mine who's done a survey on this called Circumcision Harm. He's got his survey results online, and it's with pictures of harms that have resulted from circumcision and descriptions of the types that people have had. It's circumcisionharm.org, I believe. But there are plenty of men who are circumcised and do not feel any problem. They don't feel tightness. They don't feel, they enjoy sex just fine. And not to take that away from them, but they're missing something and they don't know what they're missing. And it doesn't mean that that there's a problem with them, but it's hard to acknowledge that when you feel like everything's fine. And I think that having a son who has an intact penis is a challenge to that. And it's also a fear-based thing, because a lot of men who are circumcised feel grateful that they don't have a foreskin, because they've been told that it causes problems and it's hard to take care of. And so a lot of them probably feel the same kind of anxiety over caring for their son's foreskin as a lot of mothers do, because a lot of us don't know either, which is why I wrote my book. So I think it's a deeper psychological problem going on there. It's more than just wanting them to look alike, because everybody knows that parents and their children aren't necessarily going to look alike, but that's a deeper symbol of the cultural perpetuation that occurs and why it occurs.
Right. And that goes for like the locker room issue, right? Of like boys being teased in the locker room. I mean, one, if circumcision rates are coming down and there's more intact boys, then they're not going to be as, quote, different. But at the same time, just in the same way they say, like, well, dads aren't going to look like boys or their boys exactly in all ways, that's not a reason to circumcise. The same thing as like in locker room, like as part of teasing and the like, there's all kinds of things that happen anyway. Right.
Yeah. I mean, I was teased plenty for having red hair and freckles, but I didn't dye my hair or bleach my skin or anything like that. Well, but the locker room thing is really interesting, because I read literature from urology literature, medical literature from around the world. And since I've been paying more attention to this, I've noticed in two different articles, one was in Italy and one was Japan. And in the Italy article, they were talking about doing reconstructive surgery, and how much parents there would want their sons to have the appearance of having a foreskin, how important that is. And similarly, in the Japanese article, they said in Japan, they would never consider it normal to be walking around with the head of your penis showing, because to them that looks sexual, because normally the head of the penis shows when you have an erection, and not necessarily, or at least only partially otherwise. And so in those two cultures, it's, a circumcised penis would be the anomaly. And it's not just cultural. I mean, we're born with it intact. And so I think their cultures actually represent what's normal and what makes more sense than ours does.
Right. Yeah, that totally makes sense. Well, before we sign off here, your book, The Good Mommy's Guide to Her Little Boy's Penis, is that available on Amazon, that we can just send people over there? Is that the best way to get it?
It's available in both a paperback format and a hardback format on Amazon. Okay.
I'll make sure that link is included in our show notes and on the webpage that we put up for this. And also the circumcision harm.org that you mentioned, that link I'll make sure is available as well. In our last minutes, Dr. Carmack, what's the major take home you'd like parents listening to this episode to take from what we've talked about today?
I would like for parents to understand how much circumcision is just purely based on cultural myths. It's not based on any biologic reality. It's risky. I mean, we didn't talk a lot about all the harms, but they're numerous, and you may not have them, but if you do, it's a big problem. And that the benefits are very weak, and there are plenty of other ways to manage any problems that arise, any diseases that arise in that region of the body besides amputation.
Right. And what about for the little babies that might be listening through mom in utero? They're not here yet, or maybe listening as mom's listening or dad's listening to this episode. What kind of episode or advice would you have for that little one? It doesn't have to be around circumcision. It could just be general pearl of wisdom.
Yeah. And my advice comes from my own experience as a mother, just trying to do things better. And I hope that my children know that they can do things even better too. I know that I still make mistakes as a mother, but I hope that they know that I did my best and that they can do even better themselves.
Great. Well, thank you, Dr. Carmack. I appreciate you taking the time to share your wisdom with us and all your expertise. I'll make sure that your links to the books is available for everybody to just learn more and get more informed. Thank you so much.
Yeah, thank you for having me.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.